We advocate for immediately soon after birth is put the baby to the mother's breast and do skin to skin and for at least about 60 minutes. So the earliest with years experience I often seen is actually sore nipple. If the mother do not actually latch the baby properly, position the baby properly, and the baby has shallow latch, then she's likely to have, even after 1 feed, got sore nipple. Because of sore nipple, if she doesn't learn to relatch or reposition again without proper guidance, she may end up, without any milk at all. So her establishment for lactation may be delayed. Second is very common is engorgement. If the baby do not empty the breast effectively, mother have, the supply exceed the demand of the baby, then she develop engorgement. It all depends. Pumping, is usually advocated for or encouraged if the mother deliver a premature baby. Because the premature baby, the more premature they are, they're likely to be nursed in NICU, NICU. So the mother may not able to breastfeed. So avoid doing a lot of overtired. So you must rest as much as you can, well hydrated, and make sure you got balanced diet. So all this with the support of the family, and you actually concentrate on your breastfeeding. When you first started breastfeeding, your action is very important. The way you hold the baby, the way the baby latch deeply, and also the position. Example, I have seen mother actually holding the baby and giving the baby the wrong cue. Example, when she's holding baby, instead of let baby focus, mother is doing a lot extra thing like stroking the baby or touching the baby. You are causing a lot of distraction. So especially I've seen mother subconsciously tapping the baby. And this action in the body language means go to sleep. So every time the baby, so usually every time they go to your breast, there will be one side and use the mother as a human pacifier and then go to sleep. Well, once the new parents return home, there is a lot of fear. There is don't know what to expect. There is always this baby, usually is crying. In the hospital, because the nurses are there, so they know and the LCs are there, they got some other help. So most of the time, newborn baby a bit sleepy anyway, got a bit of jaundice, but once the baby is home, they're all well, and the demand become more. So the baby crying is the most common problem. Sore nipple, if they're able to latch well, is unlikely to happen. And then engorgement also unlikely to happen if they're able to let the baby drain, effectively from them. Tiredness, of course, is the next problem. A lot of times, new parents, they can actually be a bit confused because there are a lot of kind people out there, auntie, your mother, or so forth. Even professional people may give her different types of advice, so they can actually get a little bit frustrated and confused. So with the conflicting advice, I suggest that proper antenatal class will help to iron this out. They are mentally prepared, they know what to expect. Sometimes, after delivery, mother may have a bit of swelling that make her mobility a little bit awkward as well. And mother can get a bit frustrated, with very heavy legs, how to move around a bit. At the same time, sleep. Because of anxiety, mother may not sleep well because the baby, if she's not used to the idea, the baby may wake up, even at night, a few times a night, some mother cannot get back to sleep very straight away, so it can affect her sleep. And in this, actually can affect her mood as well. So as a caregiver and also the supporter of the spouse and also partner, we have to help her to get over this. And understanding means a lot of support as well. They must be well equipped, mentally, physically. They have to pick up a skill. So caring for a baby in a hygienic way is very important, and also a very caring way. And also learn the technique in handling. Newborn baby actually is need to handle in a very specific manner. So that's why important they actually learn to hold the baby correctly and settle the baby to sleep correctly, even in bathing, holding the baby in the bathtub in a safe manner. So what we have to do is teaching parents in the various methods, and then to cope, what we call the 5S, to cope with a crying baby and colicky baby. Sometimes babies do get colic because they cry a lot, they get stomachache, or after 2 weeks they may develop what we call evening colic. So that's why years of teaching, I developed a lot of soothing method or approaches to help the parents to learn and pick up this skill to cope with the baby.